It's exactly 7:10. We'll get started.
Okay, thank you.
With 10 minutes over time. I'm extremely sorry for that. Welcome everyone to this launch of the report of the second survey by PPRC and BIGD on the impact of COVID-19 and recovery realities. We are very happy that the Honorable Minister for Local Government, Rural Development and Cooperatives, Mahmud Tajul MP, has joined us as the guest of honor. We have a distinguished panel here, Professor Wahiduddin Mahmud, everyone familiar with him, Professor Shantayanan Devarajan from Georgetown University, Professor Burgess from LSE and the IGC, and Dr. Fahmida Khatun of the Center for Policy Dialogue. Myself, Hossain Zillur Rahman, Executive Chairman of PPRC, and Imran Matin, Executive Director of BIGD, we will be making the presentation today. We want to hear the panelists. Certainly, we want to also hear the minister. Also, we want to allow responses from the audience. There's a large audience also who joined in. So we'll be mindful of the time. We have planned for a 2-hour session. We will not extend it. We will, the time that it took 10 minutes to start late, we will cut back on our own time to make sure that we keep within our time limit. Also, I would request our panelists to take about 7 to 8 minutes for their interventions. And, you know, we'll try and see whether there's interactive possibility. And then we'll ask, of course, the minister. I hope you'll be able to be with us for this session so that you can hear and then make your deliberations towards the end. Without further ado, let's get started on the presentation of the report. I should mention here that an initial release of findings was done at the end of August, but now the full report with further analysis has been completed, and that's what we have been launching here. Zareen, if you could start sharing the presentation.
Namira, can you give me share screen permission, please?
Okay. So Imran and myself, we will take about 25 to 30 minutes max for making the presentation, and then we'll switch to the panelists. All right. So we have the focus is on, as the title says, resilience, emerging vulnerabilities, and response priorities. Our interest here, PPRC and BIGD, was to provide researched evidence from the ground, in particular real-time evidence in terms of what's happening on the ground due to the economic impact of COVID-19 and how people and others were responding to that crisis. Next. So that's the team members. We have both BIGD and PPRC deployed a large team. And I also want to take this opportunity to thank, this was a telephonic survey. And in a way, the COVID-19 has triggered research innovations in the context of Bangladesh in terms of a big switch to digital technology for conducting our field surveys, etc. Want to also thank those respondents who really took their time from their difficult lives to share with us their findings, which has allowed us to prepare this report. Next. Okay. I now want to quickly run through some contextual realities. This survey was done in second half of June and first 2-3 days of July. An earlier round had been done in April, and that report, separate report of that, has already been shared. Now, I think it is important to highlight a few contextual realities within which the survey was being conducted and the findings would make a meaning here. Now, on the Bangladesh is, in a way, looking back, we are characterized by a sort of high infection but low mortality epidemiological situation. That's, some of the puzzles on that are yet to be understood. but that's in terms of reality, that's how it is. Bangladesh did not opt for extreme form of lockdown. We really went for a sort of a customized form of lockdown where the state really focused on, in terms of strong mobility restriction, it was on inter-district public transportation was restricted for up to June. Schools have been closed and continue to be closed, and places of worship was also closed for a while. So it was in a way, a limited but very targeted approach to the lockdown, not a generalized lockdown as such. And the community too, at the local level, they, in a way, because there was no generalized from the central level, very strictly enforced lockdown, it was a lot of micro-level adjustment varied across communities in terms of how they would do the mobility restrictions to contain the spread of the infection. And I think the most important part of this story here is that Bangladesh, on the one hand, we did not have a strict lockdown, but had a sort of a targeted lockdown, plus community level micro adjustments. And on the economic front, it was an incremental and quite early resumption of economic activities, which on hindsight may have stood Bangladesh good in terms of its economic sort of performance. It was incremental. It was not also at one go. And that is also an important thing. And partly this incremental and early resumption of economic activities also has been an outcome of the way, partial lockdown, but strict in some areas, micro-level adjustment, they led to this incremental and early resumption of economic activities. And in a way, this is the, go ahead, go to the next slide. This is a timeline actually. On 8th March, the first infection was reported. And then there was an initial period of actually panic in terms of what is to be done. And there was a general what was called general holiday was announced on 26th March. But on 25th March, the one particular sector, which is a very important export sector, R&D, was partially allowed to be restarted, but then again, it went into closure and again restarted. So if you look at this timeline, you will see that Bangladesh had the essential part of this story is that there was an initial period of panic and there was a complete stopping of economic activities. But early on, people in a way overcame the fear factor, and the pandemic management and government also in a way, I think, tilted towards the life versus livelihood debate, tilted very strongly towards the livelihood part of it. And on hindsight, this early resumption of economic activities may have muted somewhat the extreme impact of the economic lockdown and closures. So as you can see down the line, essentially by mid-May, the activities had begun to be started, but as you can see, it's also in fits and starts. And from June onward, more or less, economic activities has been started in a much broader way. But certain mobility restrictions remain, like schools remain closed, and community level adjustments continue to be done. The PPRC-BIGD second phase survey, as you can see, the report of which is being presented now, was done between 20th June and 2nd July. Okay, next. Okay, Imran, I would now hand over to you to explain the scope of the study and the next part.
Great, thank you very much, Zillur bhai. So what we are going to be really presenting is results from the 2 rounds of surveys, and so the second round of survey was done during the early phase of the recovery. So I think a lot of the results that we have are early recovery. So one of the things we try and do is not focus so much on, the estimates of sort of different recovery and other types of results, but actually try and provide a bit more of a analytical points and sort of distillation of certain key themes that emerge. In terms of the survey, it was 7,638 households. 58% were panel sample, and 41% were new sample. And we also had additional 93 households, a very small sample on the Chittagong Hill Tract. It was a very small sample, so we don't really, report that much around it. We primarily focus on the sort of panel sample primarily, and in some cases also the panel and new sample together. Sort of primarily it was 43% was rural, 56% urban, about 1% Chittagong Hill Tracts. In terms of occupational distribution, it was primarily unskilled labor and micro and small enterprises were the two kind of predominant, kind of occupation profile of the sample. And these are pre-COVID occupations here. Next, please. We also, so BIGD has been involved in a number of other studies and surveys. We launched a rapid research response, as a part of which we did, a number of other studies. We also are drawing from, some important other surveys that we did. One is on the small and medium enterprise and the workers, that was done in collaboration with Monash University. And another one, briefly, we'll also talk perhaps a bit on the education survey we did with University of Malai. If we move on, okay. So next, please. So the way we have organized our story is, first of all, to talk about a bit around, what are the kind of, the larger, the overall dynamics through which the longer term poverty may be being caused. And then we move into unpacking the vulnerability to look at some of the critical heterogeneities that basically emerge. So this is the overall framework that we use, so the overall story is that there's been months of low income. Now we don't say no income, we say low income. That's primarily because there's been a lot of micro level adjustments in terms of mobility restrictions and resumption of economic activities. So it's been primarily months of low income rather than no income. With that, there has been the support that has been provided. It has been inadequate. We'll talk about that. We'll evidence each of these, points. So with months of low income, generally very inadequate support that's been provided, along with a very unflexible non-food expenditure, which essentially affects primarily the urban households, urban slum households. All of these three forces together leading to coping mechanisms where we increasingly see a depletion of savings and moving to debt dependence, reduction of food consumption, and reverse migration. And all of these together causes grounds which are likely to create long-term poverty, more chronic poverty, poverty traps, and reversals. So that essentially is the overall storyline. Okay, now let's elaborate on each of those. So months of low income, what we see between April and June, despite the fact that there's been incremental resumption of economic activities, what we see is still on average, still in June, the average income both in rural and urban slum areas remain to be below the poverty line. So whatever recovery is happening is still, at least until June, July in the early phase, still quite low. And we have grounds to believe that the adjustments that people are making because of low income, because of inadequate support and inflexible non-food expenditure has led to crisis coping mechanisms, which may lead to more long-term poverty. Okay. So the second point is really around the external support. In our survey, we asked both in rural and urban areas, urban slum areas, about external support that people received. We found that only 39% households received any support, despite the fact of, the kind of income drop that we have basically seen. And for those who received support, and this is an important point, that it amounted to roughly 4% of the lost income due to COVID-19. So not only the support has not been widespread, the amount, the adequacy has been fairly limited, which basically makes this support, and we asked people about different crisis coping mechanism, receiving support from external sources has not been mentioned as a very important crisis coping mechanism because these are not really reliable. These are, things that people get as largesse or as sort of charity, as on top of what they would anyway do, coping through consumption reduction and other types of mechanisms rather than relying on external support. And I think this is a very important point in terms of the way our social protection fails to enter the crisis coping, a reliable crisis coping mechanism for poor people. Okay. Next is the point around the accumulating non-food expenditure. And here we see that in the urban areas, primarily, it's an urban slum phenomena. The utility expenditure, especially rent, is relentless. It's been relenting, relentless expenditure, in terms of, its inflexibility and inability for people to be able to negotiate these utility non-food expenditures, especially rent for urban slum, which obviously has had very important consequences in terms of urban poverty and reverse migration. Okay, so those were the three big dynamics: low income, months of low income, inadequate support, external support, and fairly inflexible, non-negotiable non-food expenditure. And the way poor people have been sort of managing is and this is about the urban, the rent point before I move to the coping mechanism is, you can see here that, 2/3 of tenants were still paying the same rent as pre-COVID period. Extreme poor households have the lowest bargaining power. And with respect to, percentage of slum dwellers who live in rented house, you basically see a sort of pattern there. So this has been, the rent burden has been particularly, I think, trying and painful for urban slum dwellers. That has led to some of the crisis response mechanism with respect to consumption expenditure reduction and ultimately reverse migration for certain groups. Okay. So now we move to, how have people actually coped? Reducing consumption, that has been, the most important, one of the most important ways in which people have coped. And that has really important consequence in terms of, nutritional outcome, especially for critical age periods such as children and pregnant mothers. And, there are other studies which look into those nutritional impact, and I'm sure we will, this is one of the very important reversals in terms of overall human development and human capital formation. So per capita food expenditure went down and remains to be at the more or less at the same level between April to June. Despite the economic activity gradually increasing, it remains to be at the more or less the same level as it was just in the initial days of the lockdown. And the dietary diversity remains to be low. We found no milk and meat since March for majority. Next slide. And this is, again, with respect to when we ask people about food consumption, reduction in food consumption as a crisis coping mechanism, that remain to be, a predominantly important crisis coping mechanism, for most households, even in June. Again, this I think speaks to the fragility of the resumption of economic activities and the longer term consequence. Even if income does, bounce back later in the later time, such long periods of food consumption impact and nutritional impact, especially on the more vulnerable groups, are likely to be quite severe. Okay, and so one was reduction in consumption. The other was drawing down on savings, and then once that savings drawing down was kind of depleted, moving to debt. And that is also something we basically see between April to June, an increase in dependency in loan and grocery credit and, essentially debt. We obviously it was a phone survey, so we could not really collect a lot of details around the nature of this debt, but this is the trend. The overall trend we find is a shift from savings depletion, which itself is, I think, extremely important in terms of economic recovery steps we take. So there's a saving depletion and a debt accumulation. So both of these together, has also been happening. Okay, and then the third, kind of crisis coping, especially for urban poor, has been reverse migration, leaving cities in 15% from Dhaka to urban area to rural villages, 8% from Chittagong. So it's from more expensive cities moving into the rural homes. And we'll see later once we unpack this and who are actually migrating, what is extreme poor, or which categories of households are actually migrating, and we'll have something to say on that later. Let's move on. Okay, now let's unpack. So until now, we try to provide in some ways the grand narrative with some evidence in terms of the sort of overall dynamics in terms of what we think is happening and leading to chances of increased long-term poverty. Now, if we really unpack this, there are certain groups and certain types of themes of heterogeneity that basically emerge. So the first one is the widening gender gap. The female labor force have been, suffered the most with respect to this crisis. So females are twice as much likely to become unemployed, half as much likely to find another job compared to their male counterparts. The female labor-intensive work has been most affected. Housemaid, beauty parlor, tailoring, and some of this remain to be. I mean, I was out in the field, recently, and beauty parlor remains to be, a sector that is struggling to basically sort of open up, given the nature of the activity. And can I just move to the workers' income loss? No, if you can just workers' income loss, the hyperlink there, please.
Hyperlink.
The hyperlink, workers' income loss, yes. Yeah, so this comes from the small medium enterprise survey that I mentioned that we did in partnership with Monash University. Here we look at during lockdown in July, we see that female workers are struggling compared to their male counterparts in terms of getting back to work. So in terms of the first graph is percentage of those who are employed. So you can see during lockdown, there's been a 58% reduction, but it's 58% were employed. It went up to 84% for men, but for women, it just went up to 62% from 48%. So the drop has been higher and the recovery has been slower. And in terms of those who actually have been back to work among women, we see that the earnings have been lower. So in terms of the second graph is with respect to drop in monthly income. You can see that the drop obviously was very high during lockdown. For male, it has recovered and has gone to 29.46% drop. about 29%, and for female from 64% to just 52%, of the pre-COVID, relative to pre-COVID income. So both in terms of finding work, but also in terms of income, we find that there is a very important feminization of this COVID effect. And this has to be a big priority in terms of policy responses. Okay, can we move back? Yeah, that click, yes. Okay, let's move to the next one. So gender is one big one, and then let's move to the next one. So this is based on work that we are doing with LSE, Robin, and Oriana and the team there. And this is also really, really important from policy point of view in terms of misallocation. So what's really happening, so these are micro and small business. So what we are seeing is that micro and small business, so here we are utilizing, so these surveys had benchmark surveys. So these were surveys we did in 2017 and 18 initially, the original survey, and based on which we drew a sample to do a telephone survey. So we used the wealth level of the small medium enterprises, and we use from the 2017-18 survey, and we use the February income as a marker of efficiency of these small and medium enterprises. And what we find is that the endowment matters. So what is happening is for enterprises that have lower levels of endowment, they are finding it much more difficult they're being squeezed out of the market. They're finding it much more difficult to come back, reopen, and they are much more likely to exit the market despite being more efficient. So we may be actually, the overall outcome could be that at the market level, we may end up with a lower level of overall efficiency. So this is not only about equity, this is also about efficiency in terms of lower endowed small, medium enterprises being squeezed out of the market and finding it more difficult to reopen and sort of come back. We had another analysis where we looked at, in terms of entering the market, people who were not small, medium entrepreneurs before and trying to, get into small business. There also we find a very strong initial wealth effect. So this is something that I think is also extremely important in terms of our policy response. I'll now pass on to Zillur Bhai to take you through to some other heterogeneity dynamics.
All right. Thank you, Imran, for that. I wanted to also mention here that because food security has been a key focus of this study, we were very happy that this year's Nobel Peace Prize winner, World Food Program, was also supported this second round study, and hopefully will be also supporting the third round study. So really, both a congratulations to World Food Program and a thank you for that support. So just continuing on Imran's sort of analytical conclusions is that just focusing on resumption of economic activities is not telling us the whole story of what's happening. As he mentioned, earnings recovery has to be an important focus. Who is getting that scope, like the widening gender gap? But also what we find is that even when people are able to find some different job, it's lower down on the scale of skills. So it's basically more informal, low-skill jobs. That's the alternative by which you are trying to get back into the world. So that's another angle of the informalization is a very important part of this story. Next. And this is very important is that the urban households, I think the COVID impact, a big part of the story is occupied by the urban poor, urban services, occupations of the urban poor, which are informal, higher food prices and the higher burden. So urban has been really disproportionately affected. Next. This is very important. When we first announced this finding in late August, we had not done the further analysis. And in fact, the media also reported very strongly, and we actually found that this is an important trend, that people were leaving the cities and out of the higher cost burdens and lower income prospects. And there was an expectation that it was the poorest who were, of course, leaving. But that doesn't seem to be the case. When you did the further unpacking, as you can see, it is more the upper end of the poorer groups, the non-poor in the slums, the vulnerable non-poor and the moderate poor, who have migrated more than the extreme poor, who have had to stay put in the urban centers. Because partly there is a cost of migration too, and partly maybe their opportunity to go back to the places they left is a lower opportunity here. There is an important story here actually in terms of what type of people actually have gone back out of the cities. Next. And as you can see, as I mentioned earlier, even when they have gone back, they have tried to find activities, livelihoods, but it has again been mostly into casual, unskilled labor. And as you can see, unemployed, already 26%, but it's unskilled labor. So essentially, the alternative you're looking at is casual, unskilled labor, and people with skills are also really not having that opportunity to deploy their. So that's an important part of this vulnerability. Next. Okay, so as has already been mentioned, actually, that months of low income, inadequate support, and accumulating non-food expenditure, they led to these negative coping mechanisms: savings depletion, debt dependence, food consumption reduction, and reverse migration. And this may end up in causing longer-term poverty, even though the early resumption of economic activities carried an initial story of resilience, which is true. In fact, let's go to the next slide. That there has been, important part of Bangladesh's story since the last 7 months has been resilience. That has been in news also. But once we have unpacked the data, what you see that, yes, resilience, but there are now risks of reversals and new traps. For example, reversal in the reduction in poverty, emerging new poor, people who were above the poverty line have fallen below. And between April and June, we found that the percentage of new poor, which is actually people who were not in the original count of poor, now are poor, their percentage really have not declined much, only 1.1% between April and June. So reversal in reduction in poverty is one of those reversal risks that we have to really bring into our focus, despite the fact that resilience is also a part of this story. Second reversal is nutritional reversal. Because Bangladesh has been, in a way, all countries who are trying to reduce poverty and have succeeded, Bangladesh also has done, the trend has been towards a starch-centric diet to a more nutritional diet. Now there is a potential for a nutritional reversal here, particularly for growing children. Particularly in months of food poverty, we have seen that it may have an impact on stunting, and that's a reversal we have to be concerned about. Next. The second set of reversals is the reversal in human capital. Significant and continuing learning loss is putting a generation of children at a new human capital disadvantage. And this is particularly from poorer and rural families who have unequal access to technology. There has been innovations to leverage digital technology to overcome the school closure. But because of the unequal access to technology, you have this potential for reversal in human capital. And the other one that I mentioned, the reverse migration. But the nature of this migration is push migration. Originally, when people migrated to cities, dominantly it was a pull migration, attraction of newer opportunities. This is a push migration, inability to survive in the cities, the high-cost cities, and now going for this uncertain opportunities in the rural or semi-rural, Mufassil towns. So this is more push than pull. And interestingly, that's what I think is a longer-term puzzle that we have to unpack, is that the extreme poor are having to stay put in the urban areas. But is the slightly above group, who are perhaps more skilled, have more human capital, they are having to actually being forced out of these cities. This is also important. It's a potential trap also that we need to be looking at down the line. Next. Two other final traps that, or reversals that we should mention. One is, of course, the health reversals. In fact, what we find is that more significant than gaps in pandemic care per se, because as I mentioned, by May, people had almost taken the popular psychology was really to opt out of testing and hospitalization and go for home-based care to the extent is possible, or just go back to livelihoods. So pandemic care per se lost focus in people's eyes, but disruptions in reproductive and child health services was a side consequence of the overall impact on the health system of the COVID-19. And that has led to, problems of, for example, spike in adolescent pregnancy, and also child health issues like immunization, etc. rates, those are being affected. And there is unfortunately also a continuing neglect of key reform priorities, which have deepened the overall health sector challenges beyond pandemic management per se. And the final risk that I mentioned is what I already mentioned, is this labor market informalization. Bangladesh already, the employed population by the Bureau of Statistics data, about 87 to 88% are actually informal jobs. Now, informal jobs, not all of them are necessarily, a cause for concern. But what we find as the impact, economic impact of the COVID-19 is that there is a labor market informalization, push the skilled people being driven down the skill scale towards, and there is a potential whether we are entering into a low earnings trap and a widening gender gap. So these six, very important part of this story has certainly been resilience. Bangladesh resumed activities quite early. That has played an important role, but we have also opened the possibility of longer term vulnerabilities, particularly the six reversals that I've mentioned. Let's now go to the end in terms of certain policy conclusions, and we'll quickly end there. First, what does this all say in terms of policy recommendations? First, on economic recovery. What we find is that, as Imran mentioned, is that low capital base but efficient micro, small enterprises are being squeezed out. So there is a critical need for new stimulus package for low capital but productive MSME through alternative delivery platforms. That is a very key one, important issue, because government was generous with stimulus packages, but they utilized those delivery platforms which were really not customized to address this clientele, meaning banking system. But we have the MFIs, etc., who are more capable of dealing with these sort of clientele, and that's a critical recommendation that one likes to make. Second one is this widening gender gap in the labor market has to be addressed through specific skills and financing support program for urban and rural women. And lastly, all this discussion about stimulus cannot just be about financial stimulus. Stimulus is as importantly about targeted and effective policy support, need-based policy support. Many of the economic export and domestic economy sectors that we have been talking to during this survey has been that yes, financial stimulus is important, but this policy support stimulus is equally important. Second set of recommendation is about the whole theme of social protection. And I think Bangladesh has a very fairly strong, robust social protection portfolio, but a whole lot of it is, or main part of it is for the rural poor. The urban poor really has not been in focus. And I think COVID-19 is driven home the idea that it's time for Bangladesh to now scale up urban social protection. And the two other social protection concern here is that there is a new clientele, this new poor, for whom actually during the pandemic, one program was tried, a cash support program for about 5 million people, but actual delivery could not happen because of targeting challenges, etc. So more effectively targeted cash support program for the new poor, that's the important recommendation. And lastly, this issue of nutritional poverty of the extreme poor, particularly if we keep in mind the problem of child stunting, which is about a third in Bangladesh context. That we don't want to see a spike in that. That has to be addressed. Next. So two other boxes for the recommendations. One is health. Health, again, very importantly, what we found, particularly the COVID period response has shown the greater weakness of the urban primary healthcare system. And we need a specific, in general, Bangladesh has been lacking a urban primary healthcare system, a strong one. We need a specific push on that. And I hope the minister will perhaps touch base on that. The two other ones is that one of the side effects of the COVID-19 response was disruptions in reproductive and child health services, which has had specific consequences. Those need to be addressed. And it is important to bear in mind that the discussion cannot all be about economic recovery. The pandemic is still here. The prospect of a second wave is there. We have to really also strengthen our preparedness for a possible second wave. Finally, on human capital. Now, there is an immediate challenge of the learning loss, and how do you recover from that? There has been an inadequate discussion on it. So we need one of the recommendations we're making is an urgent priority national consultation on how to address this learning loss recovery. And finally, this COVID-19 response also is an opportunity frontier. I think Bangladesh has been struggling with the quality education agenda. And I think if we are going to address and leverage the innovations that has been tried during this period, we need to revisit the quality education agenda with particular attention to pedagogy and a new teaching mission. So these were some of the policy recommendations which really came out of this study. This brings us to an end of there's annex. Let's not go into that. We can just omit the annex part of it. So just to conclude, we have concluded actually, but the PPRC and BIGD is committed to providing this real-time evidence. We surveyed in April, we have done it again in June. We are hoping to do once again in December. And as I said, the World Food Programme has been also providing some generous support, supplementary support to undertake these surveys. So now I want to complete our presentation here and bring in the panelists. I'm mindful of the fact that time is pressing, but I would like to now open the floor to the panelists and bring in Professor Wahiduddin Mahmud first. And as I said, 7 to 8 minutes is the time frame that we will be. Professor Wahiduddin Mahmud.
Okay, Zillur. I'm partly appreciative of your report, partly quite critical about some pessimism about the traps, which are good to flag signals, but I don't think the traps, I think that the traps we can overcome. But since it's 8 minutes, I may not be able to go into that. First of all, the value of this study is that whatever may be the ultimate footprint or lingering effect or traps, that's speculative, is the real-time evidence of the real hardship of people at a time like this. This is undeniable, and the type of hardship and the way of coping mechanism that they first use some of the savings, then they start to borrow, but then microfinance is not able to tackle these sort of things. And the lessons from that, I mean, the Honorable Minister is here, is that is there an opportunity now, looking at this, how we dealt with this crisis, is to look at some of the inadequacies of our social safety net or social security measure system. This is an opportunity. First of all, that to make it more targeted, that the types of assistance is more to support livelihoods rather than just relief. Relief has to be there depending on the, I know that the government is formulating a comprehensive social security depending on the entire life cycle of vulnerable people. And also a lesson that at a crisis like this, whether there is enough flexibility in the system to take care of the new poor, whether they are they remain permanently poor, that's a thing of poverty trap, but at least to timely respond to that. Now, as regards whether these will be traps, depends on the type of economic recovery and the speed of the economic recovery. Excuse me. Bangladesh produces many development surprises, and one of the surprises already is at least visible, is that Bangladesh is, after the lockdown, 8 months, the so-called post-COVID new normal apparently is almost like pre-COVID normal. Everything is going on as it is. I mean, I hear that the Cox's resorts are even overbooked. The only difference, the only thing I think difference is that the schools are already shut, and the small things like cineplexes and stadiums are closed. Otherwise, apparently, only the urban areas were affected by lockdowns, and the urban areas look to the normal eye, normal. But as the report says, that there are hidden things. I think the recovery is in Bangladesh is speedy. One of the reasons is that Bangladesh resilience, as Zillur was emphasizing, Bangladesh has been exposed to floods, has been exposed to man-made months of lockdowns, political lockdowns, and the poor people have enormous coping capacities that we have seen at times of floods, in times of other natural disasters. The only thing which is, I mean, it has been mentioned. I mean, this is a real emphasis. It will depend on the how we support the small enterprises, because small enterprises are the ones which creates, which has been most dynamic in Bangladesh's economy. And although in a net basis, we have seen over the long run, the dynamism of small enterprise sector is behind that. I mean, their net number grows, their size grows. There has been so much of scaling up. Bangladesh is one of the economic strength is that the small scale enterprises have been always scaling up. But there is behind that, and you are very right, that there is a large number of the mortality rate and the new entries are in very large numbers. Now, in cases like this, in crises like this, of course, there has been mortality. I mean, they have been shot, and these are the enterprises which have lost working capital. The large enterprises will thrive again. I don't think, I mean, the stimulus package is there, but even that stimulus package won't be entirely needed, only because these are loans. But the small enterprise, to reach this financial support to small enterprises to replenish their working capital is the main challenge. Once you can fix that, because that's where Bangladesh's economic dynamism depends, except two other external things which is not under our control: RMG export and export of workers and remittances they send. This is where the recovery will depend. And if we can successfully manage that recovery, then of course the other traps will be automatically taken care of. Bangladesh's rural economy is already very diversified. Agriculture only takes, in terms of full employment, only 17% of the labor force. The larger part of even rural labor force, and even including semi-urban areas, are non-farm activities. And these are the small enterprises which have been scaling up. So if that, I mean, that means that Bangladesh was already in the rural economy, which is diversified economy, was running in full capacity. And I don't think ultimately if Bangladesh, I mean, Bangladesh will come out of these traps you mentioned, then this reversal of will not persist. The urban to rural reversal will prove to be transitory. Ultimately, jobs will be created in urban areas, and economic growth will always be accompanied by. We can take this opportunity to see if we can decentralize our urbanization. Whether you have mentioned that the labor force is being reallocated in terms of their formality, their occupation, their gender. Can we take advantage of this reallocation to create more jobs and opportunities in small towns and peri-urban areas, so that will solve the problem of congestion in cities which have been always there? And lastly, in terms of other traps, I agree that there is a health trap that Bangladesh, one of the reasons why Bangladesh economy has come almost to the normal, that's because for reasons not known, the mortality rate from COVID is very low in Bangladesh. But we don't know, there is no reason to COVID, community spread, which is taking place now, is no less than anywhere else. Not only mortality rate is low, but also asymptomatic cases are far outnumber serious symptomatic cases. So that people have taken it as a way of life, and they are coming out to take their normal activities. And if all the activities are resumed, and provided the small scale enterprises can be given enough help so that they can replenish their working capital, so that not only we can bring back the ones which have closed down, but also we can resume the normal lateral entry, not only just scaling up of micro enterprises, but lateral entry of small enterprises. Then we will resume that dynamism in the small and medium scale sector. And then that will automatically change the rural-urban, urban to rural, it will reverse to rural to urban again, because the rural economy, as I said, is already more diversified than any other country. It's it won't be able to absorb any more labor coming from urban areas. I will end by saying that this is an opportunity to revamp the public health system, particularly in terms of access to basic health services for the poor. One of the reasons, again, I come back, why people are taking COVID as just like any other thing is just because whatever may be the daily rates deaths from COVID in a country where there is exactly 49 deaths per day from road accidents last year. And there is increasing midlife mortality from non-communicable diseases, mostly created by pollution, including respiratory disease. We should pay more, this is an opportunity to pay more attention to that, because that's even related to COVID. There will be more COVID-like crises, health crises, and the health system should be revamped to take care of that. And I fully agree with the education trap. That is a real loss, a loss of one academic year, and the digital technology which we have been using is creating more rural, the poor-rich divide. And I only hope that we can come out of that and we can. Thank you. Okay.
Thank you. Thank you, Professor Wahiduddin Mahmud, so much for your comments, and also the optimistic tone about if we can get our policies right, that these tracks may not eventually come to be a major part of the scenario as we go ahead. Can I now request Professor Shantayanan Devarajan, a professor from Georgetown University, USA. Shanta, please.
Okay, well, thank you very much. First, it's a delightful opportunity to reconnect with some old friends. And it's also nice, I always enjoy thinking about Bangladesh. So this is really, I'm really grateful for this. And also, I really think this is an enormous contribution. The data, the real-time data on the ground that you have collected and put together is extraordinarily valuable. And I want to say, it's not just for Bangladesh. There are lessons here that actually apply to a lot of countries. I've actually been doing some work with some African countries on their response to COVID, and some of these lessons translate. And so let me start by just putting this in a framework, both the analysis and the policy conclusions in a framework that might help sort what are the priorities that we need to emphasize. And the way I look at it is that COVID is a temporary shock. It's a very big one, but it is a temporary shock. And as the two speakers mentioned, it's a temporary shock that could have permanent effects. And those are the traps, that you could have a nutrition shortfall that can then have long-term effects on the people suffering from it. But this is a temporary shock. And the thing that surprises me, frankly, is that Bangladesh is used to temporary shocks. This is a country that probably has experienced more cyclones, hurricanes, droughts, floods, and a whole series of other shocks. And as Wahid said, also road closures due to hartals and other things. And I always thought, especially back when I was a chief economist and looking more closely, that Bangladesh had actually evolved some pretty efficient mechanisms for responding to temporary shocks. You have cash transfer programs, food transfer programs, and so on. But it's clear that the government response to this shock has been clearly inadequate and really not commensurate with the scale of the shock, and it doesn't strike me as being commensurate with the response to previous shocks, where there was a much more aggressive response. Now, some of that, as Zillur mentioned, has been that the social protection system is focused on the rural sector and not the urban sector. But I think the one principle that I take away from Bangladesh's previous experiences with shocks and responses is that we do need to emphasize cash transfers, using cash as the mechanism by which we cushion the blow to poor people, as opposed to a whole series of subsidies and in-kind transfers and things like that, which often got very complicated, got very poorly targeted, were very inefficient. And I would like to use that mechanism, that principle of cash transfers, in looking at some of the proposals here. But the other thing to keep in mind with this way of looking at this as a temporary shock is that the shock, the COVID shock, has exacerbated existing problems in the economy. These problems existed before COVID, but it has brought them to light. I mean, we've seen this, the informalization of firms, that already was there. You already have a large number of informal firms. It's increased, but it means that we should have been working on the informalization of firms before the shock. And now maybe the shock, as Wahid and others were suggesting, maybe the shock will give us the impetus to work even more so. And it's the same thing, and I'll get to it with health and education in a minute. But if you look at it this way, that there's temporary shock, this is a temporary shock, first best would be cash transfers, and then we should work on the long-term problems of the country that have been exacerbated by these shocks. Then I'm not sure about some of the proposals, some of the policy proposals that have been put forward. For instance, this support to firms and medium and small enterprises. The only thing there, I mean, I have no problems with supporting medium and small enterprises. I'm not sure that the correlation between wealth and efficiency is perfect. In other words, you actually have inefficient small firms, and you also could have some efficient large firms. So if you're using the size of the firm or the size of the firm's wealth as a targeting mechanism, that could be unproductive. Similarly, the discussion about rent, and that there should be higher bargaining power of the poor so that they can get a lower rent. We have to keep in mind that then that means that somebody who owns the house is also going to get less rent. And in some countries, I don't know whether that's the case in Bangladesh, this can cascade into the financial sector. And you can get financial sector problems by cutting back on rent. And I would say that's another example where you don't want to tinker with the housing market at this stage, as long as you have adequate cash transfers to help the poor manage through this crisis. The point about migration, and it's the non-poor or near non-poor who are the ones who are going to do the reverse migration. Now, by the way, that's a common phenomenon around the world, including international migration. And I suspect it's also the people who migrated into Dhaka and Chittagong before. That is, even the rural urban migration tends to be people, not the extreme poor, but the near extreme, the near poor and non-poor. So I'm not troubled by that, because I think those are the people who are going to migrate back when conditions improve. Then the health, I think the statements about health and the evidence about health is actually extremely important, because what that's uncovering is that there are fundamental problems in the health system in Bangladesh. Again, before COVID, about prioritization. What you've got is actually a very a poorly functioning primary healthcare system. And it's not unique to Bangladesh. look at India, look at Pakistan, and others as well. But what COVID does is actually it does some real dangerous things, because it's very tempting to neglect immunizations, to neglect childhood diseases, and all of that in order to save the COVID patient. In fact, there's a paper by some colleagues in the research department of the World Bank where they did the calculation, which is for every adult life saved by COVID prevention, how many child deaths do we sacrifice? And for low-income countries, mostly in Africa, with high mortality rates, child mortality rates, it's about 1.6 to 1. That you could lose 1.6 children for every adult death prevented. So I think that again tells us we need to fix it. Then finally, on the education side, several people mentioned this lost years of learning. The thing to keep in mind is that learning outcomes were not great to begin with. You know, we've done these studies now of the learning adjusted school years, years of schooling, LAYS, trying to understand for every year of schooling, how many years of learning takes place. And I just looked up the numbers for Bangladesh, and it's basically for the average for Bangladesh is about for every 12 years of schooling, it's the equivalent of 6 years of learning. It's about 50%. So, and we know that there are lots of reasons for that, but the thing to keep in mind is that means that if the children are out of school for 1 year, they're only losing 6 months of schooling, 6 months of learning. Now that again, though, let's turn that around to our advantage, which is that just tells us we should be doing things differently in educating the children anyway. And let's use this opportunity, as Wahid and others were saying, of the fact that the children are out of school to experiment and try new ways of learning. And there are ways out there we know that maximize learning in order that when they go back to school, we can increase their learning potential going forward. And I really think Bangladesh has the opportunity to innovate in this area the way it has in so many other areas. So let me stop there.
Thank you, Nanta. That was very good. And I think your experience from other contexts has come in very useful here. I now request Dr. Fahmida Khatun, Executive Director of Center for Policy Dialogue, to come in and also mention that those who are watching, if you have questions, comments, please write in the chat box. Our team will note that and communicate to us. Thank you. Fahmida Khatun.
Thank you, Zillur Bhai. Thank you very much for inviting me. This is a really very important, very timely and interesting study, the livelihoods, coping and recovery during COVID-19 crisis. And I would commend the team of BIGD and PPRC for undertaking this study. In fact, they have been continuing this study since the outbreak of COVID-19 in March. So I would start, I think many of the issues which have been quite important, which have come up during the presentation, have been discussed by two eminent speakers before me. But so with the risk of repeating, I would like to mention a few. And I would also start from where the other speakers left, that is the issue on policies. In your presentation, towards the end of your presentation, you ended with some recommendations which are very important under 4 categories. So the first one, you mentioned about the economic recovery, and you mentioned the importance of new stimulus packages for the low capital but productive MSMEs, and also you highlighted the importance of reducing the widening gap between widening gender gap, so the gap between male and female workers and entrepreneurs, and also the you mentioned very rightly the disbursement of this the stimulus packages, which is very low for these small entrepreneurs. So now, what has been, if you look at the structure, the combination of the stimulus package which has been announced, which is quite a significant amount, I would say, for a country like Bangladesh, where resources are limited, which is 3.7% of GDP. But if you look at the structure, the composition of the stimulus package, that shows that more than 82% of this stimulus package is liquidity support, and the rest, 17.8% or so, is the actual fiscal stimulus. Now, what has happened that in case of the liquidity support, where also the support for the small and medium enterprises are there, about 20,000 crore taka has been allocated. But if you, every other day, the media has been reporting that how the disbursement pattern has been, whereas we see that the disbursement for the larger businesses has been very fast, and for some of the sectors, for example, the export-oriented industry, it has been in fact more than 100%. I mean, they have, I think they have applied for the third round of their support. So, but on the other hand, if you look at the disbursement for the small entrepreneurs, it's quite a dismal picture. There are some practical issues there. If you look at the, and particularly within that 20,000 crore, 5% has been allocated for specifically for the female entrepreneurs. But why are the disbursement trends are different from the large entrepreneurs? If you speak to the bank officials or the banks, they would say that there are some practical problems because, of course, the previous speakers have mentioned about the scalability of these entrepreneurs, but also we see a huge or significant number of enterprises, the small enterprises, they have no transaction record, or they don't have any credit records with the banks, and many of them are also not registered. They don't have a trade license. They don't have a TIN number. So that's why when they are asked to submit the documents to the banks, they don't have the adequate documentation. So banks are reluctant, and also the reluctance is because they are not sure of extending the loans to someone who is totally new, who doesn't have any record of this. So this is a practical problem. So that's why I think the researchers have rightly pointed out that the distribution channel of these funds have to be different from the from the traditional banking system. Rather, the organization, microfinance institutions, SME Foundation, PKSF, and also through various chambers, these have to be, because the rural economy had been depending on the traditional services of the microfinancial institution has been quite significant in Bangladesh. So I think this is an opportunity to revive that and to channelize the resources which has been allocated for that. As within the this small entrepreneurs, female entrepreneurs face the most difficulties, because we are right now undertaking a study on the stimulus packages, how the women had been benefited or how they are accessing. Many of them are not even aware of the of such facility which has been announced by the government. So this is another real challenge. So here comes the access to information becomes another deterrent to having access to funds. So in this case, various chambers and organizations which are working at the grassroots level, their role comes in. I would quickly also want to cover the other issues, the social protection of course, the importance of cash transfer has been mentioned by the previous speaker. And I thought also that this was an opportunity to think about universal social protection. The government has a plan for the last couple of years, but the implementation of this and also how to operationalize that plan, the national strategy for social social safety net programs. So in order to operationalizing that, administrative, technological preparation, all these have to be done. And this was an opportunity to, and this is still an opportunity we can think of that for the coming days. The health issue is another thing, another issue which is very important. Indeed, if you look at the stimulus package or the support measures, the health sector, um, though COVID-19 has been primarily a public health crisis, but if you look at the support, only 0.83% of the total funds which have been allocated, this is only for 0.83% is only for the purpose of the healthcare services during crisis, which is really low, which is very insignificant. And a recent study by UNSCAP that shows that they have done a CGE modeling simulation, and it shows that you need 2.5% of GDP to strengthen the public health infrastructure to deal with the COVID-19 situation. But as we know that the health allocation is very, very low, less than 1% of GDP, and that has been stagnant for the last many, many years. And health sector is indeed the epitome of a sector which has been, fundamentally weak even before the COVID-19. And during crisis, the weaknesses of sectors come out, it becomes more evident, and that has happened to the health sector. And this is, I must also mention that this is not only about allocation, but also about the governance and management and the quality of health services. So this is again an opportunity to strengthen the health issue. But as the paper mentions that I think health sector has been left out, and it has been left to its own to manage because it's now a forgotten issue, because we are now more geared towards the recovery package, towards implementing measures which will recover the economy. So now again, it has become a neglected sector and forgotten sector. Last, the issue of human capital. One thing I must mention that, of course, the recovery of the learning loss is very, very important, but we also have to remember that what kind of learning we would need. Now, for many, many years, we are also talking about the quality of education, and the quality of education is so important for the new opportunities in the labor market, because despite a large number of educated young labor force, they don't have any jobs in the market. But on the other hand, of course, the market is not large enough to accommodate each and everyone who enter the labor market. But we also see that we have to import labor force or services of human resources from neighboring countries. So which only shows that the quality of education, which is that has to be catered to the demands of the market. And with the COVID situation, the designing of the education has to be, I think, thought about, because this education will be technology dependent. And after the COVID, I think the jobs which will be available, the nature of the job would be totally different from what we have seen during the pre-COVID period. Many jobs which were traditionally being done by human resources will not be available. That we were discussing even before the arrival of COVID-19, that the fourth industrial revolution is knocking at the door. I think with the COVID in the horizon, that has come much faster. So we'll have to redesign so that there is not a digital divide, and the labor market does not become another another area for creating more inequality. That's one. Lastly, that I would like to end with this, that we see that at the macro level, Bangladesh has done so well, and we are being compared with many other countries in the world because of our GDP growth, the resilience of our GDP growth, and the resilience has been because of export, remittances, and agriculture. But obviously, this presentation and also the macro scenario, there is a mismatch. There is a difference between the macro scenario and the micro scenario. And this only emphasizes the fact that we have to look beyond the averages. So the averages may tell a different story. But if you look at the ground realities at the micro level, then you see the weaknesses or the issues which are to be considered. That becomes more evident, and that is the reality. If we want to synergize between the macro policies and micro policies, we have to actually look at these issues which are evident at the grassroots level.
Thank you.
With these, I would like to end.
Thank you, Dr. Fahmida. Thank you so much. I want to now bring in Professor Robin Burgess of LSE and the International Group Center. Robin.
Thank you very much, Zillur, and also thank you to Imran for inviting me to do this. So I wanted to kind of step back a little bit, but first to say that I spent much of my day doing advisory on COVID to many different governments around the world, and this survey, being very early, was extremely useful to get some picture of what was happening with livelihoods in Bangladesh, and then to use that to discuss with governments elsewhere about how to respond. The way I wanted to step back was to remember that shocks like this, which I think this would be classed as one of the major shocks that Bangladesh has experienced. Indeed, most economies around the world, it's a shock of a magnitude that certainly during my lifetime has not been experienced. And the reason I wanted to mention that is I think that presents opportunities as well as difficulties. So what I'm going to do is basically divide my comments into sort of three groups. The first is to talk a little bit about, I'm going to focus pretty much exclusively on jobs, because I think, as Wahid was saying, I think the recovery of employment is the most important sort of target that one should have, because that will help to deal with many of the other issues. But I'm also going to talk about some, because working with Zillur and Imran, we've been doing some analysis of job dynamics using these surveys, and say a few things about the churning, what's happening. Obviously employment has gone down and up, but there's been a huge amount of changes in the work that people have done, and that varies by how wealthy people were to start with. So I'll mention that a bit. And then finally, I'll say something tentative about what policies might help to recover employment and livelihoods. So for a very long time, I've been working with BRAC since 2006 on the ultra-poor graduation program. And I think it's fair to say that I've learned more about poverty and what affects poverty from that work. We've worked not only in Bangladesh, we've also worked in Africa. And we have some recent work using this now 11-year follow-up to the ultra-poor graduation study that really does suggest that there is strong evidence of poverty traps in Bangladesh. What we mean by that is that people are poor not because they have traits, they're not unable, they're not low ability, they're poor because they lack opportunity. So to take a very concrete example, in the ultra-poor graduation, we're finding that people who are pushed just above a certain threshold of assets, 11 years later end up doing much better jobs, having more assets, including land. And this is from very tiny differences to begin with in 2007. Why is that important? That's important because effectively what COVID is doing in Bangladesh is to push development backwards. So typically we see people moving from less productive jobs to more productive jobs, from rural areas to urban areas. And we're seeing exactly the reverse happening now in Bangladesh. And the question is, well, how do we learn from that? How can we learn from that, not just about what's going to happen next month or even next year, but what should be the policies that the Bangladesh government and BRAC and others should put in place to have a sort of a build back better approach rather than just a coping approach. Because I think if you, for example, take the history of the UK, the Second World War was absolutely fundamental in, for example, the creation of the National Health Service, because it was suddenly recognized from that enormous shock that we need to do something about the poorest section, the health of the poorest sections of the UK. And I think the COVID is of such a magnitude that I think there is an opportunity here to kind of change our thinking about how to support livelihoods, how to encourage livelihoods. And I'll say a couple of things about that at the end of my comments. So moving to the sort of this study, which I think is of the ones I've seen, and I've talked to many governments about it, is sort of the best because it's so quick. It's giving you this very, very quick picture of what's happening, not just in April relative to February, but then in June relative to February. And what basically you see is a collapse, understandably, because of lockdown of employment, and hence enormous increase in poverty in April. But then a recovery in employment when we come to June. The difficulty is when you begin to parse through what actually happened in that transition between pre-COVID and June. What we did with Oriana Bandier at the LSC, working with Imran, and I see that Narayan and Atiya Rahman, Narayan Das and Atiya Rahman are here, is to begin to look at sort of three categories of workers. So the first, the most vulnerable, are the casual laborers who work on kind of daily wages and the like, and these are both in rural and urban areas. And then we have a grouping which Wahiduddin also mentioned, which is the businesses or self-employed. Again, they bear a certain amount of risk. And then the most secure, which are the salaried workers. And as we look at that transition from February to June, what you basically see is the biggest hits in terms of employment and income and so forth are amongst the casual laborers and the businesses, the SMEs, the self-employed and so on. But what's interesting is, of course, that the business workers have more resources, so they're more able to withstand the shock. The group that is most hard hit are the casual laborers. The more interesting thing, if you use these surveys, these livelihood surveys from 2017 and 2018, you start to see a picture whereby, which Imran was talking about, which is that people, the wealthier people are more able to withstand the shock. So the businesses that survive are businesses owned by people who are wealthier in 2017, 2018. And what that means is you've got a rise in inequality, because the people who are moving into the better jobs, which, for example, salaried employment, into businesses, as Imran mentioned, new businesses, they are the wealthier people. What's happening is that the poorer people who have businesses or in better jobs are losing that employment, and they're falling back into casual labor. So what you've got is a very clear picture of not only rising inequality, the people who have wealth, whether they are more able to stay in the better jobs or to re-enter those better jobs. So it's not that there's been a huge amount of churning. So a lot of people, particularly those more profitable but poor individuals, are falling into kind of the lowest rung of jobs, which are these casual labor type jobs. And that's happening both in the cities and the countryside. As everybody has mentioned, one of the huge differences from what we saw before is the rise in the urban poor. So these are people who are now, because of the loss of employment, who are now poor and were not poor in 2017, 2018. And so that raises a whole big question about what does one do going forward about not only the poor that we knew about in the rural areas, the casual laborers, the types of targets of things like the ultra-poor graduation program, but also what does one do about these the new poor, the ones that are in the urban areas. So to sort of finish on that, let me just mention a couple of things. I think if you take a kind of a perspective of several years or even several decades, it becomes clear that one cannot just rely on consumption support. What consumption support will never allow people to change the jobs they're doing. And fundamentally, the permanent removal of poverty is to do with people getting out of less productive jobs and into more productive jobs. And so I think Bangladesh, given how innovative it's been, not only in the NGO sector, but also in the government, should be kind of leading the world and thinking about what I would just class as big push policies. So policies that are actually of a magnitude that you can actually change somebody's employment. And I say that for a couple of reasons which are not COVID related. The first is Bangladesh has got an extremely young population. So much of the challenge, as Shanta was saying, that the evidence is that the kind of traditional education sector is not preparing people particularly well for the kind of jobs that are going to be present in the urban and rural areas. So one has to think, I think, firstly, so in terms of blocks of areas, kind of big push type policies, one clear area is in the area of training. So how does one train people to enter more productive jobs from the countryside and elsewhere? Because eventually the tide will turn and migration will start to be about people moving from the countryside to the urban areas. So I see training as one big class of things which can help this transition of people into better jobs, which will have permanent effects for the duration of their lives. And I think one needs to think of those types of policies. The second class of policies are very much these ultra poor type livelihood support, because effectively they are about changing employment or diversifying employment. And I think one area where that has to happen more is in urban areas, because for several reasons. One is obviously there's a new set of people who are poor in the urban areas and they need support. But also we're going to have to remember that climate change and other factors will be another factor which will push more and more people from rural to urban areas. So in the West, we worry about cross-national migration, people coming to Europe, people coming to the US. But actually the bulk of migration will be about people moving in terms of climate affected people from the rural parts of developing countries to the urban parts. And we need to think about policies that kind of allows that to happen. How do we manage that process? So I think livelihood support policies that are of a type, of sufficient magnitude that people actually change the jobs they're doing as a second class of policies which are worth thinking about. And they would have been worth thinking about pre-COVID, but they're even, I think it's even more important to think about them now because we've got this additional challenge. And then finally, there's a set of policies which are around how does one keep firms, which Wahid was mentioning, how do one keep firms going, which are the firms of the poorer part of the population. That we're seeing very much that, as Imran showed, that the poorest, the more profitable businesses of poorer people are going out of business before the less profitable business of richer people. And that's bad for the economy because that means that people who have built up a business over time, made it run, made it add to the economy, are now being pushed into things like casual employment. And if one takes the theory of poverty trap seriously, that is not only a problem for their immediate livelihoods, it's a problem for their entire career, because what we're seeing, for example, in Bangladesh, but I'm also seeing in India, I'm also seeing in Uganda, also in Pakistan, is that there's a process of scarring that's taking place. So people, the poor, are losing, for example, business owners are losing those businesses, people who are in better jobs, in self-employment and the like, are losing those types of businesses. And if we can think about ways to support the poorer end of small business owners, that might be also a third class policies, whether that's through microfinance or other policies. So I see those three: training, livelihood support like ultra poor graduation, and microfinance and other financial support for the very poorest of the businesses. Because ultimately, all the job analysis suggests we need to focus on people who are either being stuck in casual labor or have been thrown into that because of the COVID crisis, and about how to get them out. But I think I'll close there. But thank you very much for an excellent.
Thank you.
Thank you.
Thank you, Robin. Thank you. Thank you all the panelists. I think there was added enormously to the discussion. And I'm so thankful to the minister that he's patiently listened to all these. And I'm sure there have been a lot of food for thought for his own particular ministerial and as a policymaker, his responsibilities. From the audience, actually, we got not so many questions, but some observations. And I think one thing to clarify is that the urban sample was mainly for the urban slum areas, where, of course, there were also non-poor members within slum type locations. And I think some of the other observations, for example, from Professor Martha Chen, Robin's, I think, intervention about specific policy support areas has been answered. And there were some questions about why, for example, the fact that widening gender gap, particularly with regard to women's access to financial services, has been known for a while, but why is still not policy happening? Anyway, I think so the open floor type of segment is really not required anymore. We'll move to now to the guest of honor, the minister, and I just for his benefit, I want to mention that there are multiple areas have come forth where his particular jurisdiction is very critical in terms of urban social protection, in terms of urban primary health care, in terms of rural regeneration, in terms of the delivery platforms, the NGOs as well as the local government. So I would like to welcome now Muhammad Tajul Islam MP, the Minister for Local Government, Rural Development and Cooperatives. Please go ahead.
Thank you, Mr. Zillur, distinguished participant, and I actually it was a very good presentation you have given, and I appreciate the people, those who have collected all the data from the micro level, and they have compiled and presented today. And I also express my gratitude to the participants. They have given their reaction from their own perspective. I think all these things are very okay. But background, we know everybody. Actually, from Bangladesh perspective, actually, we were observing the COVID situation since March 26. And 8, when in March 8, when we have identified one case in Bangladesh, so we became very confident that it had been penetrated within our society, so that we are not actually not that much. We have to be careful. So from this time, Honorable Prime Minister, she has declared a comprehensive policy guideline, and the directive have given. In 3rd April, Honorable Prime Minister covering all these issues which could be probably happen and which we have to face. So all these things, we want 31 numbers directive she has declared. And accordingly, a national committee have been formed. There is a lot of criticism. Despite all this, I think there is we can say there is some value, some success, and there is some sort of controversiality there. But beside all these things, I think, though it is a very critical situation and critical issue, especially for Bangladesh, it is a very highly densely country, and literacy and awareness and many other issues. Bangladesh is much more behind of many other countries in compared to the developing countries. Developed countries, they are facing this situation very critically. So Bangladesh was definitely, it was a good apprehension about us. But I believe personally that despite it, there is a lot of data have been collected, that there is a many areas have been identified where there is a requirement to be addressed. It's okay, but actually, as a whole, whenever I will give my comment, being even not a minister, being a sensible citizen of Bangladesh, that I will definitely have to say the thing have been addressed as much as possible from the part of government, and despite it, there is some criticism could be happen. But actually, that's about all the individual issues that you have identified, that the urban slum and the and policy support, gender gap. So about the slum area, actually, whatever the scope is there, actually being a minister, even after lockdown, I every day mostly attended in the office. And we have already mostly formally, informally, and through the virtual meeting, we have connected and we have discussed the situation, how and what could do. Actually, it was a very new event for all over the world. So from the error and trial, everybody have learned and they have changed their status and policy choice could be sometime it did not been work straight line. So we are also in the same situation. So in the slum area, we have given our support accordingly as much as possible, despite it, there is a lot of constraint because physically it was difficult to appear anywhere else. And policy support, I think from our part, actually, as much as possible, this policy was taken for the comprehensive issues to be addressed. And the gender gap issues, actually, if I like to say, you see, about the stimulus package, both I want to give the explanation together. Stimulus package have been chosen, but you can say that it was the large and entrepreneurs, they have they got the chance to enjoy maximum percentage of the stimulus package. But actually, you see, once the large industries, that is those who are the even textile industries and many other industries, where there is a good number of the female and male workers working. So once those industries could not been active and it had not been worked, so definitely the huge job loss will be caused. So this was one of the fundamental. Another issue is that this is the very critical situation for not only us, for the even USA and for any other countries, Japan also, they are facing some, they are also taking the very careful step. So whenever we disburse any money, we have to be very careful. So another devastating situation we should not be faced. So this is why the money disbursement should be like this way, so that the money will not be, it will come back and it will be disbursable. And so then in some other way and subsidy to the cash subsidy have been given. So I think it is very critical in a single word. I cannot say then it was, but from the part of the government, and I also admit that the many policy stakeholders, they have given their support, they have given their impression, and government always physically or non-physically, maybe it was not noticed to the person concerned, those who have formulated and those who have created some policy or some binding. So all these things have been given according to the and beside that, you see the food security issue come. So food security, about the food security is the fundamental issue. So about the food security issue, government have been given, was very much careful. And so for the agriculture sector, government have given the stimulus program, financial package, so which have given the lot of benefit for the agriculture sector. And beside that, the seasonal crop has to be collected on time, because there is a monsoon and could be the flood and many other issues. So government have given this. I think that our food security, because we are very lucky and because our honorable Prime Minister, she is under the leadership of her, whole nation at this moment is unified. So this is why when she called the student and other professionalist and the public representative to arrange to give their input for collection of the paddy from the mart whenever that there is a tremendous shortage of the labor. So this was done. So about all these issues, I think more or less there is some sorts of the problems is there, but I believe we are this COVID duration we are passing very carefully, and in compared to any other countries, I believe that our status is not that much vulnerable and as a whole, but we are patient. So, and you have mentioned that Bangladesh peoples have a lot of experiences about to face the climatic and the political stresses in last many years, decade. So about all this experience also it is coming to the use. And beside that, I like to say that actually Bangladesh people, I believe that these peoples are very law-abiding and they are very hardworking people, and demographic dividend is very fantastic. So all this together, I think the situation, upcoming situation is not that much challengeable, and moreover, our foreign reserve is cross $40 billion, and the remittance is appreciable, and export is meeting our target, above the target. So I think it is okay. But even after that, you have identified many small issues, which is very, I think, useful for the government to take in cognizance. And this is why I feel encouraged to join with you, and you all many eminent and distinguished have given their many opinion, and in my delivery I cannot compile all everything, but I admit with many issues, and maybe some small difference could be had here, but definitely it is very beneficiary for us. And I believe that in such kinds of organization like PPRC, and whatever finding they could give, and government will take it in cognizance, and I believe that we can work together, and all the opinion of all of you and Mr. Hossain Zillur, I think you will not hesitate to forward me after conclusion of this program, synopsis of this your finding and recommendation. Then I will try to give the input about all this discussion. And beside that, one small issue: primary healthcare. About you in primary urban healthcare. So primary urban healthcare issue, actually, yeah, we have actually this is depending on the local government entity have to be it has to be active, empowered, and it has to be contributory. So I don't like to say that this is not contributory, but it is okay. Still, it is working. But we have to admit that we were ruled by the military by about more than 2 decades, and cause of that, their immorality, and that there's many organizations of the state, whole the organization, and the people's ethics, and that many things have been tarnished, and cause of that it is difficult. It comes to a big challenge. Actually, it is not only challenge for Bangladesh. I think for whole over the world, especially for the developing countries. This is a challenge to make all this organization very performing and accountable. So, but we are working to make all these local government entities to be active and contributory organization, so that it will take time, but it is going ahead. So I think in altogether, once the local government entities in urban areas, the Purushoba and city corporation, once they will very serious about their responsibility have to deliver, then the primary health care is one of the option, and it will be addressed. So thank you very much. Thank you, everybody. Thank
you, Honorable Minister. Thank you so much for both for your presence. And just to highlight that, I think it has been a very important issue that both at the policymakers level as well as at the people's level, the approach really has been of doing things and learning at the same time, because we did not have the choice of just stopping and then learning and doing things. It was actually innovating while on the run type of scenario. I think the minister rightly mentioned about how the Boro harvest was successfully completed by a social, social initiative also added to that. So that I think very important. I think the speakers also have mentioned about the resilience part of the story, which is in a way is a very important part of the Bangladesh story, the resilience part. But nevertheless, we have also highlighted, I think, the PPRC and BIGD study have, the 2 rounds of survey have really we tried to bring through real-time evidence to really look at the trends and see what are the conclusions to be drawn there. I think we have taken quite a bit of time, but nevertheless, we are within our time limit still. And I want to, Imran, if you want to say just for 1 or 2 minutes, anything?
Yes. Yeah, thank you. Thank you, Zillur. I know, I obviously from BIGD's behalf would like to thank, I think all the honorable minister, but also the panelists. Just a few things, from to take away from me. So one is I think we need to take the idea of churning and limbo much more seriously than traps only. So they may not be traps, but the churning and the limbo itself can be costly. So I think whether there's a trap or not may not be the most important question from equity and efficiency point of view. It's much more about the churning and people being in limbo and the cost of that. So I think that's something I think analytically we need to take much more seriously. The second point I want to raise is around urban and urban data. I mean, obviously we need the slum area. I think urban, it's sort of clear our research and evidence and our understanding of urban dynamics and our knowledge on urban space is quite patchy. Most surveys don't even capture kind of low-income settlement or middle class and also the pavement dwellers and informal slum dwellers as well. So our urban knowledge and our urban data gathering thinking needs to be rehauled significantly to be able to really grasp with the urban realities in a much more comprehensive way. I think third is really around, because we have looked at the kind of local economy dynamics, and I think Fahmida started talking about it. I think we have to look at this as a part of the overall global flows and global economic dynamic as well, and then basically figure out what the overall vulnerability and recovery picture would be. I think that's the third area I think that would be important. And sort of lastly, we are committed to continuing this partnership, and in December, most likely we are planning a next round. Most likely is going to be a kind of face-to-face regular survey, but we'll have to basically explore. But yes, we will be continuing this partnership. So thank you all very much.
Thank you, Imran. Thank you for that. And I think you have also drawn the appropriate lessons from some of the comments from our panelists, particularly about whether the traps, churning, limbo, etc. I guess this was really educative in terms of, in a way, it's a ongoing thought process. The discourse is really ongoing. We've tried to offer some real-time ground level evidence. Just to conclude, I think, as I mentioned, resilience is very much an important part of the story. But I think the emerging vulnerabilities, if they are not taken into account, they may become a self-fulfilling prophecy. I think we need to really be alert to that the policy response will then make sure that they don't become self-fulfilling prophecies. I think that's a very important message, and I think the big ticket concluding comment that I could make is 2 things. One is that the data, etc., all are there. Now, in terms of looking ahead, as in December, we'll come back to you with a new set of information. But I think in terms of a way of thinking, we need to see this whole new shock as also an opportunity. I think that came through in many of the comments. And the opportunity, and I think Robin's choice of language about big push policies is also useful here. I think there are 3 areas where big push policy, not incremental, but big push policy is extremely urgent. One is health, particularly urban primary health care, but health as a whole. And I think it is not a big comfort that mortality rate is low in Bangladesh, when the general health out-of-pocket expenditures are so high. So I think health is certainly one of the big push policy area that, and it's also an opportunity here to really look at how to really move ahead on that. Quality agenda, again, I think Shanta reminded us that maybe learning loss, after all, 12 years of schooling, only 6 years of learning is hinting at a bigger quality agenda rather than the learning loss per se. But nevertheless, the learning loss certainly is a short-term agenda we have to address. But I think the quality education agenda as an opportunity, I think in particularly what I see is that the pedagogic approach and the overall structuring of the education scenario, where teachers have been pushed to the margins and have been forced to become more like administrators rather than teachers. So a new teaching mission and a pedagogic foundations of education, that's an opportunity. And the third one is particularly urban social protection. I think urban, everyone has mentioned urban, but it's a new, and that is some policy work to be done. In fact, PPRC is working also with the World Bank in developing a policy framework on urban social protection. That's a very important one. And finally, the other big push area that we need to think of, taking COVID shock as an opportunity, is that for the last 2-3 decades, we have relied on 2 major growth drivers, the RMG sector and remittance. And I think the vulnerability of the global system has been exposed, and also the need for the domestic economic sectors to also get into focus is important. So the whole discussion about new growth drivers, I think is also it's the COVID context is the right time to start in a big push way, the whole discussion about the new growth drivers. So I think on that, I want to close, but with a last request to our guest of honor, the minister, that on urban primary healthcare, if you recollect in another webinar, I made a sort of proposal that the Ministry of Local Government, the Ministry of Planning, and the Ministry of Health all have a particular stake in this whole scenario. And in particular in urban primary healthcare, a coordination of these stakeholders is critical. I want to again repeat my proposal to the minister and to your 2 colleagues from the Planning Ministry and the Health Ministry, that let us have a high level, ministerial level, sort of a policy brainstorm which can make a big push in terms of a new policy ownership, policy buy-in for a scaled up big push initiative on urban primary healthcare. I leave that request to you for you to think over and discuss with the colleagues, but want to thank, I hope that's an idea that Minister, you can really take home and reflect, and if you feel, I'd be very happy from our side to really in a way steer that conversation. But sorry, go ahead.
Sorry, just a small comment. Yeah, actually the primary health care, actually I did not even go to the explanation. Actually, we are working for that. Actually, we have a right policy, support is there, but there is some sort of the constant and some sorts of the situation we are facing. I know, I have to admit, but we are trying to overcome. Actually, I have taken the charge of this ministry of in 2019. So that then after 1 year, actually, this COVID situation we are facing. So anyway, within this constant, we are also working, and several meetings by this time we have held, and we are also seated sometime with the health ministry if there is any sorts of the support is required from their side, and we are working for that. I think it is okay. I definitely I agree with this. And about the quality education, I think government is optimistic. I think your I think finding and suggestion will be we will take it in cognizance for the implementation. So, Mr. Zillur, thank you. Yeah.
Thank you so much, and thank you our panelists from Bangladesh and from all across the oceans, and our partner organization BIGD and all the team who have worked behind. And apologies for the technical delay in the start of the program, but I think we have managed to have a good discussion and conclude on time. Thank you everyone, those who have watched both by the Zoom link and through Facebook Live. Want also to really thank you for watching. It's on record, so it's available for others also to look at your leisure. These are important issues. These are not we haven't said the last words. Obviously, this is ongoing discussion. We will come back in December and see how far our prognosis is working out, in which way and in what direction it should be looked at. Thank you all so much. Have a good night, good day, good evening. All the best. Stay safe.